As discussed earlier, the hypnotherapist should never use hypnosis for the conditions that he or she is not qualified to deal with. This issue is more prominent because of the analgesic potentials of hypnosis. Inappropriate use of analgesia can mask the symptoms of a serious pathology. Generally, hypnosis is a therapeutic modality. In some psychological contexts, it can be a diagnostic tool. The therapeutic nature of hypnosis magnifies the importance of making a clear diagnosis before applying hypnosis. In terms of diagnosis, the clinician should approach the symptoms throughout the classic differential diagnosis and exclude them one by one. This kind of diagnostic approach is beyond the scope of this course. The assumption is the audience of this course is qualified enough to make a precise diagnosis. Now, let's focus on the therapeutic approach of hypnosis. Generally, there are 5 therapeutic approaches in hypnosis. A. Imagination. For example, in ulcerative colitis, the subject may be asked to imagine what the distressed colon is like a tunnel with red and inflamed walls. Highly hypnotizable subjects are divided in 2 large categories: imaginative subjects who see pictures and colors, and dissociative group, who the separation from the environment is more prominent. In the former category, the imagination can be a great platform to implement the treatment plan. B. Metaphors are another form of imagination which indirectly can be used to implement the treatment approach. Like the patient with low self-esteem may imagine a strong tree. Metaphor is not necessarily in the form of imagination. Past life therapy has been a source of controversy for years. In this course, we have a pragmatic view towards that. In another word, if it helps us to manage the symptoms, why not to use that? We are not discussing the philosophical stuff here, and we are not about to prove or deny the reincarnation. All we need is to use it to treat the patients. You may assume that as a metaphor or a literal truth. I personally never suggest directly about the past lives due to the risk of pseudo-memories. We will discuss about pseudo-memories later in this course. However, if the patient has a tendency to experience the past life in hypnosis, I don't resist against that and keep going with the flow. I have an interesting experience in that regard. Years ago, I had an asthmatic patient on oral steroid medication for years. During the hypnosis session, she mentioned she was hanged in what she called her previous life. After the hypnosis session, she came off the oral steroid medication, and her symptoms were well managed by salbutamol spray only. C. Suggestions are the backbone of the therapeutic approach. We implement the therapeutic approach through suggestions. Hypnosis is not a therapy by itself in most cases, and an appropriate suggestion script should be used for treatment. The best thing to do is to use condition-specific scripts tested by other hypnotherapists in terms of efficiency during years of practice. I highly recommend the book Suggestions and Metaphors published by American Society of Clinical Hypnosis. If you can't memorize the wording, it's okay to read from the script. However, try to practice that again and again till you become comfortable to incorporate the script into the hypnosis session naturally. D. Unconscious exploration is another therapeutic approach. In that case, hypnosis can be combined with cognitive therapy or psychotherapy. Age regression phenomenon provides an extra opportunity to dive into unconscious mind and forgotten childhood experiences through hypnosis. We will discuss about age regression later on. E. The last approach mentioned here is to use hypnotic phenomena for therapeutic purposes. The classic example is catalepsy. because the cataleptic hand or foot does not feel pain or sometimes even touch, you can use catalepsy as an analgesia.